Welcome back. My article for this month looked at the impact of atrial fibrillation in retired world-class rowers. So in this study, researchers compared 121 former elite rowers against 11,495 age and sex match controls from the UK Biobank. And the question they were trying to answer was, were retired elite rowers at greater risk? And if so, how much greater risk were they for getting atrial fibrillation? So the participants in this study completed a thorough questionnaire on their health history and athlete history. In addition to that, each athlete, so the rowers, underwent a comprehensive cardiovascular evaluation. So it was a medical history questionnaire, alcohol consumption survey, and then they had a 12-lead ECG or EKG to look at the structure and health of their heart. And that would allow them to identify abnormal heart rhythms. And then they also completed a cardiopulmonary exercise test, so a graded exercise test, to also evaluate their heart and lungs and muscles. So what they ended up finding was that the rowers, about 1 in 5 former world-class rowers, had atrial fibrillation. So this was a 7-fold higher prevalence compared to the general population. And in addition to that, long-term cardiac remodeling from endurance training appears to play an important role in becoming at increased risk for atrial fibrillation due to the chronic training volumes and the amount of time that the heart is placed under stretch due to the consistent cardiovascular activity. So this article will provide some structure and outlines onto screening that you can do and some things to be mindful of in terms of symptoms and potential risk factors. Be sure to check out my article for this month.